Hello everyone, I'm Rosanna and this is Sammy, and we'd like to thank our amazing team for all the work we've done today on tailored medication management. 80% of visits between patients and clinical professionals result in at least one prescribed medication. And 50% of these medications aren't adhered to as they should be. So, I guess the question we need to ask is why these non-adherence rates are so high. And so for a minute, just kind of put yourself in the shoes of our good friend Philip. So Philip's just been diagnosed with arrhythmia, among a range of other chronic conditions as well. During his brief 20-minute consult with his GP, he's been prescribed a range of medications. He's been recommended a number of different lifestyle changes. And so you can kind of imagine that Philip's walking away from that and he's feeling pretty confused, he's feeling overwhelmed, he doesn't really have a proper understanding of what his symptoms could be or how they could present. He could have an expectation that these medications are going to have an immediate impact and they just don't have that. He could be feeling a little bit isolated and not really knowing where to turn to get the information that he needs between his GP visits. So there are obviously a range of solutions available to try and fix this problem. And a lot of these are centred around just medication reminders. And while these can have a big impact, they kind of lack that personal touch to keep the patient engaged. So, how might we improve patient engagement in treatment plans to increase the likelihood of medication adherence? And that's what we've worked on today. So, introducing DocBot. DocBot is a personal healthcare professional with a human touch. It's a messaging bot which follows a clinically aligned sequence that is at the fingertips of Philip and supporting him through his visits between healthcare professionals. So what this looks like in practice is it's interactive with the GP and their systems that they have in place, so there's minimal setup time. The system can essentially read what's been prescribed, what the underlying chronic condition is, and it can go from there in terms of starting off sending its reminders to the patient about their medication. So we try and keep this fairly friendly and conversational, and along with that comes a range of other benefits to keep the patient engaged between their visits, such as information about how their medication is actually helping their chronic condition. I guess information about different phases of the journey that they might be on and life experiences, as well as links to additional information, support groups, anything of the like that can help them, I guess, keep engaged with their stay between visits. What it can also do is it can red flag when Philip hasn't been particularly responsive to his reminders. He hasn't really been engaging back with the chatbot, and this could raise a flag with the GP to follow up and maybe re-engage Philip between those sessions so that he does manage his condition properly.
Great, thank you. I wanted to ask, had you thought about, chatbots are a fantastic idea, I think, and putting it into the medication process, I think, is a really good one. Did you have some conversations about different generations and different personality types, and whether the chatbot could be, you know, I suppose changed on the actual person? Could it be personalised?
I guess the idea, initially was just to kind of be more aligned with, what the chronic condition is and what the medication is that they've been prescribed. In terms of, the age gap, it is kind of why we went for more of a chatbot scenario via SMS to start with, because not everyone's comfortable using an app, and not everyone's comfortable using Facebook. So if it is via SMS, then yeah. So with the bot, it's essentially, the messaging process is completely the same as, say, messaging a friend, or it's quite familiar for most people.
Mm-hmm.
I think, yes, there's no question that the problem that you've encountered in terms of adherence and the various factors that go behind it is a very important one, and I think the solution is potentially a very good one. One of the issues that frequently comes up in these sorts of scenarios is people want more information as they encounter particular variants, as they become more familiar with their conditions, they look to search further. Have you looked at it as an integrated engine into some sort of further database or access to further information about people's conditions?
Yeah, so I'm not sure if you could see on the small screen, but the bot prompts the user, asking them if they want more information about their condition. It'll share new studies, research, etc. with them, so they're constantly being educated further on what they're going through.